Welcome to Dateline Health. This is Fred Lippman coming to you from Southeastern University. And you know, as I always say, this is your show. And we've had a number of comments, and I guess you could say verbally as well as written, about really coping with illness, you know. And we're not just talking about, you know, having a bad cold or scraping yourself or otherwise. These are complex illnesses and the impact that they have on your loved ones, significant others, or yourself. So I decided I'm going to bring in two experts. And boy, do I have good experts here. Right in front of me, we have someone who is this is the fourth star. There aren't too many people that we have on the show as many times as this magnificent person. It's Dr. Naushira Pandya, who is a professor and chair of the Department of Geriatrics here at Southeastern University, and we're so proud of all of her work. And she's been asked to spend time at the White House during different administrations because of her knowledge. So, Dr. Pandya, welcome.
Thank you so much, Dr. Lippman.
Good to have you. And Dr. Arlene Gordon. Mm-hmm. Didn't know you had a middle name, but that's good. And she is the director of the Brief Therapy Institute here at Southeastern University. And you can tell me what LMFT is, Dr. Gordon, and you can talk to us about what the Brief Therapy Institute is.
Thank you very much, Dr. Lippman. LMFT stands for Licensed Marriage and Family Therapists. We here at Southeastern University have one of the largest marriage and family therapy programs in the country, training master's and doctoral level students in the practice and research of marriage and family therapy. We've been around NSU since 1988. We have been on the main campus for over 12 years, and we provide a quite substantial community service. We service up to, some years up to 700 patients or clients, as we refer to them there as clients, and their families every year. So we service people from the Tri-County area. We try to make our services cost efficient for people who cannot otherwise get family therapy because we are a training facility.
And what is the Brief Therapy Institute per se? You just explained it, but just give us a little thought process as to who and what would the people themselves would seek your services.
Well, the Family Therapy Clinic is housed within the Brief Therapy Institute. And what we do is provide therapeutic services to individuals, family members from a very strength-based, family-friendly approach. Brief in the sense that we engage people through their systems, so it's their relationships, or if it's a relationship with alcohol, it's about relationships. So where other mental health practices might look more at assessment or evaluation of the particular individual, we look at their relationships. And so it's a natural for working with doctors. Medical family therapy has been around for many, many years. We have a faculty person, Tommy Boyd, who's the chair of the family therapy department, who has been practicing medical family therapy since 1988. So we offer a certificate in our program on family systems healthcare, specifically for marriage and family therapists who would like to work with the medical professionals.
That's terrific, really. Dr. Pandya, just before the show, off camera, we were talking about the field of geriatrics.
We're seeing larger numbers of people with very complex illnesses living longer. You know, lifespan for a woman can be 89, 90 years old if she's surviving at this point in time. And so they're living with a lot of complex illnesses, and while we have medicines and technology to help them deal with these illnesses and to live longer, we really need to focus also on the quality of their life. You know, are they able to live in their home setting or where they prefer to live? Or are their disabilities so great that they need to live in a nursing facility or an assisted living facility? And I think that's our challenge, to help people not only live longer and manage their illness and functional disabilities, but to maintain their desired quality of life.
You know, that's an interesting thing because over the years, and this is our 17th year, thanks to the viewers, we constantly hear about the quality of life issues. Mm-hmm. And it could be anywhere between, it goes all the way from the late 40s all the way up to the 80s. All people want is a quality of life. That must come to your thought process, Dr. Gordon, when you have to talk to a person and they're saying to you, gee, you know, I really feel pretty good, but I don't have any quality of life. What do you say to that?
Well, first of all, what I would try to find out from the patient was what was their definition of quality of life, because it might be very different for each person. One might be, I would have less pain. One would be, I would have my children in my life more. One might be that I would have an easier time speaking to the professionals that work with me. So how one defines the quality of life is something, that's where we would start. We would also look at the people you're describing and see how strong and resilient they have been throughout their lives. And how were they able to do that? And if they were able to still tap into that strength and that resiliency and moving forward in their life from this point on, what would that look like? And then we would try to engage the family system. Who is there to support you? In what ways? Who's the most helpful to you? How might you engage them to be even more helpful? So we see the patient as the expert of their own lives. What we have an expertise in family therapy. We have talk therapy. What can we do in our conversation to help that person find a way to navigate their system in a way that's most useful to them? We also provide coping skills and strategies to help them deal with things with pain and challenges they face on a daily life.
And I would assume, Dr. Pandya, that today, when we finally have made that big jump where we have our health professionals talking to one another.
Almost.
We're getting there. You know, I really think a lot of that has to do with the, I guess you could say, the advent of new technologies, particularly in the hospitals.
You're right, Dr. Lippman. I think people are learning, health professionals are learning to work in teams. And indeed, team-based care, as you know, is one of the areas of emphasis for our health system going forward. And people have learned to work in teams while the patient's in the hospital getting treatment for whatever acute problem or surgical problem that they came in for. And there's early discharge planning with teams working together, working with the families or the support system at home, so that there's a better transition from hospital to home. And that's really a key determinant of how successful that discharge is going to be, whether it's to home or to another long-term care facility. What the services and supports are identified and how they transition to keep the patient safe and stable in the home setting. And of course, as you know, there is a big focus on reducing rehospitalizations from community or facilities back to the hospital, because that really is, again, detrimental to the quality of life. Also, it speaks to probably inadequate planning and care in the first place that led to the rehospitalization. Areas such as medication reconciliation is a big focus for patient safety, aligning supports that are needed at home, identifying who the support system is and what the support system is at home. And then better communication of records. And I think that's really improved. In our area, we are receiving, in our geriatrics clinic, a lot more notifications of our patients having attended an emergency room, having been hospitalized, having seen a consultant. We're getting that information back now, and we're able to, be better custodians of all that information and to direct the care of our patients better.
One of the things, and I know that you have been part of this, I guess you could say, progress. We have a pharmacy school here at Southeastern University, and we have been doing medical therapeutic management
Yes.
for quite a while. Been helping the doctors understand it isn't just filling a prescription. It's the interaction between the knowledge and the capability. If Dr. Pandya writes a prescription for a diabetic patient or for a cardiovascular patient or something, or someone has high blood pressure and the prescriptions are not filled, or somebody sees that a prescription for 60 days is somehow is out there around 80, 90 days, and they're not taking the medication, there's an immediate communication with the doctor, who's really the master of the management. You know, I mean, how can you expect a physician's offices, the composite number of health professionals, whoever they might be be able to do what you want to happen without having some oversight into the management of that patient? You see that now quite often, don't you?
We do. We get notifications from our own pharmacy and also some of the pharmacy benefit, managers from the health plans about inappropriate use, inadequate use of medications, or they're very helpful when they pick out potential dangerous interactions. And that leads us to, look up the patient record, and we might find that the patient didn't keep an appointment, so we go ahead and ask our staff to make sure, to bring that patient in.
There's also a lot less, and I know this is a little bit out of your area, but I'm sure you see it, Dr. Gordon. For many, many years, going back maybe 20 to 40 years ago, there was a lot of polypharmacy. There was a lot of utilization where people would go. It's not their fault. They want to feel good, so they in a week they might see a podiatrist, an orthopedic specialist, a cardiovascular specialist, someone who is dealing with their diabetes, and yet there's no communication. Today, the medical community has really come to the point, whether it's the process of managing the patient, whether it's a process of efficiency or otherwise. I always tell our viewers, don't hide anything from your doctor. Talk to your doctor. Tell them what over-the-counter preparations you're taking. Tell them what kind of nutrients or nutraceuticals you're taking. Don't hide it from your doctor. Don't put it on the side as if, oh, this is just giving me energy, or this is doing this, and I bought it at XYZ box store, or I bought it at XYZ pharmacy. You have to let the doctors know, and you have to let your people know, because you never know where the interference is coming from. And it's so helpful. If people want a quality of life, they have to be open with their knowledge of what they're taking. You see that often?
Well, I don't see that specifically, because what I see is more the doctors actually come into the family therapy clinic that we have, the medical family therapy clinic that we now have located in ZIF, with patients that you're describing. Here's a patient that I'm having. They're supposed to be taking this medication, this medication. They're supposed to follow through on doctor's visits, and they have not. That becomes a therapeutic issue. Then we work with that patient. So what are your goals, and in what ways do you want to stay as healthy as you can? I met a woman who the doctors saw as very isolated, and when I began to talk to her, I found out that she had 6 children, and she had 14 grandchildren. So our conversation began about, so you have 20 people, at least 20 people that need you to stay well. So what's your next step in staying well? Well, I have to start exercising more. Oh, which of those 20 people will you exercise with? Well, I think I'm going to call on my daughter because she's really good at exercise. And which park are you going to go to? So what happens is we get referrals from your folks, and then what we do is work specifically with the patient on a plan for specifically that patient so that they can get the health benefits that their doctors are overseeing.
By the way, you mentioned you were in the San Fidel ZIF clinic. Where are you located in the clinic?
We are in the, we're downstairs right amongst all the, we sit with the College of Osteopathic Medicine. So we're in the old X-ray ultrasound suite.
Yes.
We now have been...
Nothing's old, it's just reused.
Reused in a good way, in a very good way. It's a very busy spot now. We have 2 rooms now. We have, since in the 10 months since we've been there, we've already been referred 150 patients.
That's very good.
So we're very active.
I'm very pleased because, as Dr. Pandya knows, Dean Wallace and actually all the deans have adopted the theme of prevention and wellness. And in order to obtain wellness, you have to apply all of your skills. Dr. Pandya, I want to touch on something which I don't want to forget before this show is over. I know of your tremendous advocacy in the field of diabetic care. I'd like you to talk a bit about that, if you don't mind.
It brought to mind what you were talking about, Dr. Gordon. I think we have to focus on patient-centered care now. Really, we were used to a more benevolent, even autocratic way of, telling the patients what we thought they needed. And now I think we need to work with the patients. That's where healthcare has dramatically changed. And it's not more evident in any field other than diabetes, because the options of treatment are so great. Whether you take injectable therapies, 2 or 3 oral drugs, when do you go to injectable therapy, and which drugs you might choose. So patients get a lot of say, and indeed that's what's recommended by diabetic and geriatrics organizations, that patients should be working with you in determining the choice of therapy. And I think that leads to greater success. So we need to take issues of cost, what the support system is, what the functional ability of the patient is, and then determine their care. And what's helped in recent years, well, in the last 4 or 5 years, there's been a real focus on relaxing goals of control in the elderly, because large studies have showed us that tight control is not necessarily beneficial in prolonging mortality or in sort of prolonging life. And so it gives us a lot more leeway to work with our patients, to give them more flexibility in the choice of therapy.
Well, I always say to people that our viewers that they have to take good care of themselves, and part of taking good care of themselves is utilizing what I would call, with all due respect to our wonderful medical and psychological and pharmaceutical communities and at large, and I know I'm just sort of bundling that up, is that things are changing dramatically. I mean, firstly, with all of this conversation in our society about healthcare, one way or another, I'm not talking about the philosophy of it, but there is a foci on, I want to take care of myself. I don't want to die. I don't want to have pain. I want to have a quality of life. Here we are back again, quality of life. And I got to believe, Dr. Gordon, that those communications, those conversations that you're having with people in brief therapy, they must be very dominant.
Absolutely, absolutely. And the idea of helping the patient get some sort of control, as small as that might be, over their illness. So a lot of patients that we see have diabetes too, and a lot of those folks are not compliant. And so how do we engage them in supporting themselves in staying as well as they can? We also see people with a lot of anxiety. We utilize brief meditation skills, and we teach our patients how to do self-hypnosis. And that might sound scary to some people, but we often find ourselves in levels of trance. I mean, how many people have driven up to their front door, the garage, and all of a sudden, how did I get home? Because you're in that level of not acute attention, but sort of like in a mild trance-like state. We help people get to that place so that they can calm themselves down, even if it's breathing, before they go to the doctor, before they make that phone call, before they take that medication, before they go for chemotherapy. How do we help them to reduce that anxiety and stress so we give them the tools to do that for themselves? We also teach family members.
Yeah, I'm always, and I think I've told you this a number of times, Dr. Pandya, but if you have forgotten, I'm going to tell you again. I'm always in tremendous admiration with the field of geriatric care, because there seems to be a certain very specific respect for the whole person.
Indeed.
For the whole person.
Yes.
Not the disease, not the
Absolutely.
pain. Am I on target here?
No, you are. And I mean, my heart just warms up when I think of geriatric care and people who are geriatricians. I think we really love and respect older adults. We learn so much from them, from their stories, from the lessons they have learned in life. And I think that really embodies the osteopathic philosophy also very well, that we get to know not only the person's cardiac disease, hypertension, diabetes. They're more than those things to us. They're somebody who fought in a war, who is raising grandchildren, who has had some personal disappointments. We know their story, and that helps us to take care of them much better. I mean, it brought to mind when you said, people who are non-adherent with their diabetes management. I have become much more of a patient advocate rather than their sort of authoritarian physician telling them what they need. Because I think sometimes when they're not succeeding in managing that illness, I see that I have not understood something about them that is impairing their ability to take care of themselves. And I think once you try to look further and deeper into their story and identify more feasible options for them, then we get to a better place. And I try not to do it in a judgmental way.
Well, that's the important thing. We've come so far in the field of medical research, pharmaceutical utilization, new products all the time. The folks know that my first profession was pharmacy. So my third profession. But whatever it is, the bottom line is that I remember, the utilization of certain, advancements of antibiotic therapies, of pain therapies, things like that, how they mitigated different elements of what you all deal with. I think the art of medicine and health is on a rise. Do you feel that?
Absolutely. I think so. I think the idea that we allow people to make the decisions about their own health and who they engage and how they engage them makes them more hopeful. And I think when you have hope, you stretch yourself in many, many ways, including in your own health care.
Dr. Pandya, you definitely, because you see the critical side of the spectrum often. You see the dying persons.
Absolutely.
You see the critically ill individuals in the venues that you serve so well, but yet you work hard at not being, as you say, their commander-in-chief. You're the person who is their next door neighbor.
Yeah, and I see myself as that, and a sort of coach, a friend in terms of helping their healthcare, because I think if you don't work with people, you can't talk at them. I don't think you succeed. And people have a lot of knowledge, families have a lot to contribute, and their goals may not be what my goals are for that patient, and one has to respect that. And that really becomes prominent in situations of end-of-life care. I mean, for instance, I'm going now to a facility where I have to deal with a couple of people who, patients, end-stage cancer or, end-stage kidney failure, who no longer want treatment. And so I need to discuss that. Is that appropriate? Is this what they want? And what will my steps be going forward to ensure that they have, as much comfort and dignity at the end of their life?
Yeah. We're down to the last 2 minutes of this show. It's gone by real quick, and I'm really proud to have both of you here because I feel the empathy and the true feeling of kindness, which I have a tendency to want to see all the time. So, Dr. Gordon, again, where is the Breathe Therapy Clinic? It's in the Sanford L. Ziff building?
Yes, it is. It's on the first floor.
Right.
It's in the
It's just beyond, it's between internal medicine and family medicine.
Absolutely.
Right.
Thank you.
It's right at the bend of the just near the elevator, just a little bit by. And they can call for.
They can call. We're open from Monday through Fridays from 9 to 5. All of our referrals are directly from the physicians
Right.
and residents, and it's a free supplemental service through the College of Osteopathic Medicine and the Department of Family Therapy in Arlene, Hanggang.
Well, it's a great collaborative
Thank you.
effort
Thank you.
between Dean Wallace, and really I give a little throw in there to Jill Ross Wallace as well, because
Absolutely.
she's been an advocate of it being part
Yes.
of the wellness spectrum. So
Yes.
we thank you very
Thank you
much
very much.
for your kindness, your knowledge, and your abilities.
Thank you.
And Dr. Pandya, we know where you are. You're in where internal medicine is, also in the Sanford L. Zift Clinic, which is right on University Drive and 30th. And I can thank you. I personally know of your empathy and your credibility, but more importantly, of the soul that you have and you bring to medicine. And I want to thank you very much.
Thank you. I appreciate it, Dr. Lippman.
Yeah. And you are, again, if people want to, you have a whole department of geriatrics, don't
Indeed.
you?
We have 4 of the geriatricians now.
Which is odd in most places in the nation. You know, other than a couple of big cities, you don't find 4 geriatricians in one spot. But we have a full department of geriatrics.
And I should mention, Dr. Lippman, we have our new clinic at Covenant Village on the retirement center for Covenant Village.
Right.
We have a satellite campus.
And that's open?
That is open. Yes.
Open
for family medicine and geriatrics.
Family medicine. Is it only for the citizens of Covenant Village?
No, it's open to the public.
Open to the public. Okay.
Absolutely.
Thank you very much. Well, folks, you asked about how to cope with illness, and you know, I think we have some good thoughts here. And as I always say to you, this is your show, so you asked about these issues. Hopefully, we gave you some answers. I know that I feel like I've gotten some palliative care just listening to both of you. So I want you to know that again, this program and this show is yours. And if you have any questions or you want any answers, there's a telephone number and an email address right here. And remember, as I say to you, and as I said during the show, you got to take good care of yourself. Don't hide things from your physicians and other health providers. You know, make them aware of it. If you come across an issue with your pharmaceuticals, talk to your pharmacist. Find out what's going on. Don't just stand silent. And remember, we come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see ya.